Okay, good evening, everyone, and welcome to Atp Live Monday. I don't know what's the problem with us going live on Instagram. Okay, okay, I'm not quite sure what the problem is with our Instagram, but I'll try and see if I can fix it. Okay, no worries. We don't seem to have access to Instagram going live. I think there's something wrong with Instagram, but I'll go live on my phone for Instagram. Welcome everyone. Just a minute. I think there's a problem with Instagram these days. Okay, we'll solve it later. Anyway, welcome everyone. Um, just give me 1 minute to sort out the Instagram. Good evening, Nathaniel Miriam. Welcome. Thank you for joining us. Okay, so let's just go live on my Instagram, on my phone for Instagram. Because that is to require me to hold it all the time. Okay, let me see if I can. Okay, let's see whether I can hold it down. Okay, on something. All right, good. I think I'm live on Instagram and I'm live on Facebook as well. Okay. So, welcome everyone. Thank you so much for joining me today. This is Hacks the Pediatrician Live. This is a program where you get to ask any question that you may have about the health of your children. Okay, my phone is falling down. And then we get to give you your answers live. Okay, so apologies for the delay in starting the our app. It's not connecting to Instagram for whatever reason. I don't know. I'll sort it out after today. But for now, let's just manage. So welcome to ATP Live. Please share the video, invite your friends and family, and let them join us. This program is brought to you by Ask the Pediatricians Foundation. Uh, we are committed to your health and the health and welfare of your children, and we do that through all our platforms, online, offline, or through community medical outreaches. So ATP Live Monday is just one of our platforms where you can ask any question that you may have about the health of your children, and you get your answers live. So Instagram, well, you can hear me. All right, so let me just share the video as well and make sure people can see and they can hear us. And then, but if you have any question, you can start to drop your questions now. Please drop your questions, and then I will try and answer them. But I will just give me 2 minutes to share the video so that everybody can see and everybody can hear. But remember that even after the live session, if you still have any questions, you can always post your questions to our Facebook group. Our Facebook group is open 24/7, not 24/7, 24/6. That is Monday to Saturdays. You can ask any questions as far as the health of your children are concerned on Ask the Paediatrician Facebook group. For adult health issue, you can ask on ATP Family Facebook group as well. We also have ATP Still a Mom. We still have a First Time Mom group as well on Facebook. So these are the 4 groups that we have. And we try our best to answer your questions within 40 to 72 hours. Some questions we answer within 24 hours as well. So if you are just joining us, maybe, or you are watching the recording, and maybe after the live session, because the live session is just going to be 1 hour. If after the live session you still have questions, then you can post your questions to our Facebook group, and we'll try and answer them. All right, so welcome everyone. Feel free to share to any platform where people are happy or they may have questions about health of their children, and I will try and answer them. I think I'm done with all my sharing. I think I just need to do a little bit of pinning, and then we are free to start answering questions. But you can start to drop your questions now. Feel free to drop your questions. And let me just say happy Father's Day to all our lovely, lovely, wonderful fathers. We celebrate you powerfully. We love you. We thank you. We appreciate you for all that you do for our children. We know the fathers are not as loud like the mothers, and that is why fathers have had only one Father's Day. I know the mothers have had like maybe 3 or 4 already, and the year has not yet ended. So, but I know the father just have one day. So we really, really want to celebrate you, our fathers. We thank you. You are so, so important in the life of our children. And so please keep supporting our children, keep providing for our mothers, keep uh, uh, exercising your influence in the life of our children. They really, really need the fathers. So we celebrate the fathers. Happy Father's Day once again. God will continue to strengthen you to keep on doing what you need to do. And ATP is going to be 10 next month. So watch out for our anniversary. We're going to celebrate every day of the week, every day of the month of July. The whole of July is ATP anniversary. 10, so it's a 10-year anniversary. So it's huge for us, and we are really going to celebrate. There's going to be lots of activities. There are going to be many things happening. So just watch out. We'll start rolling out all the information about that very soon. Just watch out for that. So ATP is 10. And one thing we're going to be looking out for is you telling us your story. We call it your ATP story. How has ATP impacted you in the last 10 years? Just tell us those lovely, lovely stories. We would love to hear them. And also tell us what you would like us to see, us do better in the next 10 years, another decade. So watch out for that. Somebody say, how's our baby doing? Hola Yinka, hola Yemi. Okay, I wish baby. Okay, yeah, okay. I think many of you misunderstood my post about but I didn't have a new baby. It was my sister that had a baby. But it's a a baby that we have waited for so long. So we're really so excited. I see my baby, so all the congratulations are welcome, and the baby is doing fine. All right, okay. Let's start answering the questions. Instagram people, welcome. I say you. Thank you for joining us. Feel free to drop your questions. I will be answering them as I go ahead. So Natalia Mabel is asking, can I add infant formula to your baby's pap? It's 10 months old. Yes, why not? You can. You can add formula to baby's pap. That is perfectly okay. And um, but I always just want to always sound a note of caution when I'm answering question about pap, because in Nigeria it's almost as if pap is um is almost like equivalent of complementary feeding, and to the extent that mothers do ask us, oh, that my baby doesn't take pap, even though the baby is eating every other food, but the fact that the baby is not taking pap, they are worried about it, as if pap is the main complementary food. That is not true, actually. And I always say that your baby does not even ever need to take pap at all. Yes, it's not written in the constitution that babies must take pap as complementary food. There are all sorts of food in your kitchen. Almost all the food you eat in your kitchen, your baby can eat as well. Of course, when you are just starting, the texture is what is going to be different. So initially, it's going to be more of a porridge-like or mash-like before you introduce them to food solid. But please, let's not always just want to give our children pap. Okay, you can give pap, you can add milk, you can add other things, crayfish, palm oil, and other things to the pap. It doesn't have to be milk only, and to fortify it. But let's not just be giving pap. I know people that give pap 24/7. No, the children should eat other food. Then when it is now time for children to eat rice and beans, and maybe they feel that maybe when the child is 1 year or 2 years, then the child doesn't want to eat that, the child only wants to take pap or the cereals, and then we come back to us and ask the same question, maybe doesn't want to eat food. It's because when we're introducing them to food, we're just loading them with pap only. So let's not do pap only complementary feeding. I like to say pap is not complementary feeding. Pap is one of the possible things you can give your child, especially if you fortify with other things. But it should not be the only thing the child is eating. The child should eat variety. That is the key word, variety. Okay, so I hope that is clear. Olayenka, Olayemi, what can make a 3-year-old to be urinating? I hope I got what you are asking correctly. Urinating consistently at least 5 to 10 minutes interval. That's what we call that frequency. Frequency is when a child is going to pass urine every 5 to 10 minutes. That is frequent. Most of the time, children should not pass urine more than 4 to 7 times in a day, the whole day, 24 hours. So if your child is passing urine every 5 to 10 minutes, maybe 6 times in 1 hour, that is a lot of urine, and we call that frequency. It is very common in children who have what we call urinary tract infection. That is the number one thing we want to rule out. If a child is passing urine frequently, and you can also ask them, are they also feeling pain when they are passing the urine, or they feel that burning sensation when they are passing the urine and all that. So children have that in where they have what we call like urinary tract infection. Urinary tract include the bladder, include all the way down to the kidneys. They're all urinary tract, but the lower urinary tract is the bladder, the ureters, and all that. So when your child is passing urine frequently, you need to make sure the child doesn't have urinary tract infection. So the best thing to do is to take the child to the hospital. Usually, we will take a sample of the urine, which has to be collected properly, because if you don't collect it properly, you are going to get wrong information. Good evening, Major Evans. Nice to see you. Welcome. And good evening, everyone. So if you're, we will take a sample of the urine. There's a way we collect the urine. That's we collect in a very close to sterile method, so that we don't contaminate it, because there are a lot of bacteria outside the perineal area. So there's a way we collect it, and when we collect, we take it to the lab and we test it. There's what we can do, urinalysis, that can tell us whether they will see white blood cells in the urine, whether they will see what we call nitrites in the urine, that will suggest bacterial infection. And when we do a culture, that may take a couple of days to come out, we will know exactly what germ is growing in the urine, and then we know the antibiotics, okay? But we don't have to wait for the culture. So we test the urine, and then we'll give appropriate antibiotics. There are other causes of frequency. We have other problems with the urinary tract, can also cause the same, but the most common one and the most serious one that we want to rule out is urinary tract infection. So please take the child to the hospital and get a pediatrician to see. Okay, let's just take one question from Instagram, then I'll come back. Good evening, Major Evans. Say, what can cause H. pylori in baby of 3 years? H. pylori is, there's something like what can cause H. pylori. H. pylori is the name of a particular bacterium. That is the germ. That is a germ on its own. Helicobacter pylori. Is the name of a microorganism or a particular bacterium. We call it Helicobacter pylori, and it causes what we call gastritis. It causes irritation of the stomach lining, and it can give children what look like ulcer symptoms. That is not the only thing it causes, but that's the one that most people tend to associate it with. Okay, so if your child has had that infection, maybe they pick it up from the stool, there are antibiotics that your doctors can prescribe. So usually by the time you say a child has H. pylori, it means you've done some tests. It's not something you just diagnose without doing blood tests or stool tests. So the test has been confirmed, and the same doctor who make that diagnosis should be the one to write the appropriate antibiotics for the treatment of that infection. Okay, so I hope that is clear. So Major Evers, let me know whether you got the answer. Onyinye good evening. Thank for all you're doing. I'm a bit concerned. My little niece of 6 months cannot sit alone. She weighs 5 kilos. Is there anything I can do? Number one, you're not the mother of the baby, so it's a little bit tricky if you're not the mother, you're asking questions. I need to know what is the weight of this baby. The birth weight of the baby, and we need to know whether this baby was born preterm. So these are some of the reasons why we always say we can't answer third-party questions. There are certain things we need to ask that you may not know. If the baby was born preterm, we need to calculate what we call the corrected age for that baby to know whether the baby's development is appropriate or not. That is number one. Number two, the weight is 5 kilos. It's a little bit small for a 6-month-old, and I really want to know what was the birth weight, what was our starting point. If the baby was born preterm and started at 1 kilo, of course, I won't be worried about 5 kilo at 6 months. But if the baby was born at 3 kilos and it's just weighing 5 kilo at 6 months, then I'm going to be very worried. And that means baby is not thriving. And the reason why the baby is not thriving may be linked to the reason why baby is not sitting. Now, the baby sitting at 6 months is with support, not sitting independently. So there are two kinds of sitting. There's a sitting where you support the baby's back with a pillow. We call it sitting with support. And that is usually achieved at 5 to 6 months old. Then there's also what we call sitting without support. When the baby sits and the back is straight, that is what we call sitting independently. And that is usually 7 to 8 months old skill. So there are lots of information about this baby that we need to know, which unfortunately I'm not sure you can provide for us. So it's important that you tell the mom to see the pediatrician so that the pediatrician can see the baby. They can ask all the necessary questions. I also want to know, how is this baby being fed? Is this baby on breast milk? Is the baby 6 months old? Has the baby started complementary feeds? There are so many questions we need to know about this baby, which we cannot answer. This is one of the reasons for those of us on the Facebook group. I always say we can't answer third-party questions. There are so many things you won't be able to tell us, and it's really so frustrating sometimes because there's really no point when you cannot give us that information and we cannot answer. And then even when we give you answer, you don't have what we call parental responsibility to implement what we're telling you. So it's only the mother that is the parent, or the mother and the father, So external parties, I know in Nigeria, in Africa, it is the whole village that raises a child. But as far as medicine is concerned, a child has only one mother. Okay, and there are medical implications to that as well, so which is why it's always so difficult and tricky to answer question about nieces, about friends child and all that. Is so tricky. So I think that what I normally tell concerned family members like yourself is to tell the mother to see us or to come and ask that question, then we can have that conversation and we can take it up from there. Okay, Major Albert is saying, is it contagious? Helicobacter pylori is a bacterial infection. Is very unlikely. But then if there's contamination of stool with food, then that can happen. So, but if you're paying attention to hygiene and all those things, and there's no contamination of food with the feces and things like that, or with hands that is not washed and all that, it's very rarely to happen, but it can happen if there's contamination. So you have to pay attention to hygiene. Faith Kadire, good evening. Thank you so much for joining me. Silas Sarah, my 9-month-old doesn't put anything inside her mouth. Finger feeding is a 10-month-old skill. It's a 10-month-old skill. It's very important for parents to know what we call developmental milestones. Otherwise, we will just get ourselves unnecessarily worked up. So if you go to our website, we have an article, It's My Child Development on Course. And I think I did a webinar this year on normal development in children. I recommend Silas for you to read that. You need to know what is normal, okay? That's when you will know when it's abnormal. And even for what is normal, it is always like an average. So for example, if I tell you a child walks at 1 year, that is average for most children. 50% of children walk at 1 year, but there's still a child that will not walk at 1 year, and there's still nothing wrong with the child. Some children will not walk until they are 14 months or 15 months. And I, as a pediatrician, I'm not going to even worry until 18 months. So that is the key thing. So when we even tell you this is the average, there's still always that room of a child who is a little bit slower, who is catching up with. There's nothing wrong with them. They're just a little bit slower. Just like I always say, all of us are not Dangote rich. So even though you are not poor, but you're also not Dangote rich. So everything is achieved at different levels. As long as you are not, getting below the normal level, I mean the cutoff, that is when we as pediatrician worry. So if you go on that website, we actually tell you what is the cutoff that you should worry. When should you come and disturb the pediatrician about your child's development? So a child who is not a 9-month-old who is not putting biscuits in their mouth, I'm not going to worry because it's even a 10-month-old skill. So, and I'm not even going to worry maybe until the child is about a year. If the child is not doing by 1 year, then that's when I begin to worry, is there something wrong with the fine motor skills of this child? So don't be much in a hurry. And I know where the problem is, because we always compare our children. Most of us, you see another baby born around the same time or a little bit later, earlier, is already doing that, and then you start getting panicky. It doesn't matter. Everybody is not going to reach the same milestone at the same time. So there are children that work at 9 months. It doesn't mean that the child who works at 1 year is late. It's still normal. And it doesn't mean the child who works at 15 months is late as well. It's still normal. So there's a range that is normal. Okay. So you don't need to worry yourself at all. So if you want more information on that, you can go to our website, you can read. And this is, we live in the era of information age. All of us have AI access. You can always just check all these things online, like what is normal time for baby to put biscuit in the mouth, what is normal time for baby to work. It will bring it out for you. At least it will give you the generic one, and then if you now want more specific information, you can now see a pediatrician. But I'm not worried about your child at all. Miss Fumi, good evening. Welcome. I'm doing very well. Thank you. Welcome. I hope I didn't miss any question on Instagram. I don't think so. All right. Ajoke, Homoto Show. Well done, ma'am, for all you do. Please, ma'am, I did a switch breastfeeding for 6 months. Well done. Good. But right now, I'm confused on what to give to my baby. How old is your baby? Always start with the age of your child. So I'm assuming your baby is 6 months old. If your baby is 6 months old, there's no need for you to be confused at all. That's why you got ATP. That's why we got you. If you go to our Facebook group, we have a guide section. A lot of people always ask us, where are the guide section? If you go to make sure you download the full Facebook app. Once you go to the hub, you know this menu, there's a menu where you see all the headings. You will see guides. So if you're not sure, just ask us in the group, where is the guide section? Somebody will screenshot and show you how to locate the guide section. So if you go on the guide section, if you click on the guide one is on breastfeeding, which you have done successfully. Well done. Guide two is on the next one, which is complementary feeding. So we have series of videos that you can watch, what to give your baby, how to give it, how often do you give it, what should you not give, all those kind of information, very lovely. And you will see example of how the kind of food you can give, how they mix it and everything. So keep breastfeeding your baby, then go and do that guide. It's about, most of the videos about 5 to 10 minutes. I think the longest should be, I don't think the longest up to 10 minutes, and you can watch them, and I think about 6 or 7 of them, you can watch them and then you can learn how to go about complementary feeding. Luckily, when your baby is just starting complementary feeding, breast milk is still the main food for the baby. You see about 80%, so that the baby has not lost or missed so much. Keep breastfeeding, but start going to learn about complementary feeding, and then you can start. Okay. And there's no food your child cannot eat. We've also written articles on it. You go on our website, there's article on complementary feeding, how to feed your baby for the first 1,000 days. We have an article on that as well. So please go to www.askthepediatricians.com. That's our website. Let me see if I can put the link online here, because the website is actually open right in front of me here. And then you can just uh you can just read about complementary feeding on our website. You will get all the information you need. I really wish you have asked this question before your baby was 6 months old. It's always good to always prepare ahead. Okay. All right. Ogo, is it Ogo? Okolo? Good evening. Good evening. Thank you for joining us. Yeah, okay. Instagram people ask your questions, but thank you for joining. I can see many of you there, but ask questions. Gifted Mercy. Good evening. Is there a possibility of giving birth to a cerebral palsy child and the child die? Then when such person get pregnant, can the mother give birth to such a child again? Okay. Thank you so much for your question. I understand what you are trying to ask. So to clarify, a mother has given birth to a child who has cerebral palsy, and the child died, maybe from complications of cerebral palsy, and now the mother is pregnant, and it's a natural fear to worry whether are you going to have another child with cerebral palsy. And let's start by saying cerebral palsy is not hereditary. In other words, it's not something that should happen again. Okay, but why saying that? It is a very sad thing to say that, because that is my field. I've seen it happen again. I've seen mothers who had a baby who had cerebral palsy, and you would think, oh, next time we'll be more careful. Some of them even change hospital. They even decide to go, maybe they would do private the first time, decide to go to government hospital, and for whatever weird reason, something still went wrong again, and they end up having another child with cerebral palsy. As I'm talking to you now, I can just imagine that couple in my head now. This family, that this is something that has happened, but it shouldn't happen, but it can happen. So number one is, you before you get pregnant, I always tell mothers, see your pediatrician, see your obstetrician. And unfortunately, it's also one of the reasons why we have HCP, because a lot of us, we have a lot of ignorance. So most of the things that cause cerebral palsy, they are things that should not happen, because what happens in cerebral palsy, there is a brain injury, either during the pregnancy, during delivery, or after the baby has been born. And most of these causes are things that we can prevent, So for example, a baby being born preterm, it's one of the reasons that we have children with cerebral palsy. Babies that are born less than 28 weeks, especially born less than 1 kilo, they are very high risk. Now, that means that some mothers have that tendency to have preterm babies. So if they have another preterm baby, then that baby can also have cerebral palsy. But what we can do is to prevent them from having a child with a preterm delivery. So if, for example, a mother that has cervical incompetence, we can put in circlet. We just have to make all the efforts to prevent the scenario that will cause that to happen again. Some mothers are rhesus negative, so their babies are prone to having jaundice. If they are rhesus positive, that can happen again, and that can cause brain injury if you don't pick up the jaundice on time, if the mother doesn't take Rogam. And and unfortunately sometimes people end up going to the wrong places and who don't know. So I always tell, before you take in again, if you've had a baby who had a poor outcome, you must see an obstetrician. We must know what happened before so that we can put in efforts to prevent it from happening again. Unfortunately, sometimes parents are more interested in, let me quickly replace that baby. It is not replacing the baby by getting pregnant and have another child that is so important. It's more important to know what happened, what are the circumstances, how can we avoid it. For example, first time mothers, you should never deliver in with midwives. You should not be delivering in the church. You should not be delivering at home. You're a first time mother, you're high risk pregnant uh, person. So you should be delivering with the experts. You should be delivering where there's a pediatrician. You should be delivering where there's an obstetrician. So that if there's any complication, we are going in fast. If baby needs to be resuscitated, the pediatrician, we're not just looking for them. They are there already. We are prepared. The same thing for a mother who has had a child who died, for whatever reason, who has cerebral palsy. The next delivery, a pediatrician must be at that delivery. A pediatrician must be there. It's not like it's not negotiable. So nothing must happen again. We have to be there. We have to be aware even before the mother is going to deliver. The day everything, the pediatrician has to be there. We cannot be looking for them at that time. So if a mother is prone to having jaundice, sometimes your baby, the pediatrician has to see that baby. Even if there's nothing wrong, we have to see. So there are certain precautions. So usually once a mother has had a bad outcome, I strongly recommend in our Nigerian setting, don't deliver again in a private hospital. Don't deliver in general hospital. Please go to a teaching hospital. And when you go to the teaching hospital, you must let them know, because some of us also hide that information. You must let them know that I've had a baby who has cerebral palsy who died. They must know. They must be ready, because it should not happen again. We must make all effort. We're not God and we always try our best, but we should make efforts, because it's the most painful thing in the world. Because I've seen it happen, and it's the most painful thing in the world, and parents end up blaming themselves, blame the health professionals. But I would just say, if it has happened before, it must not happen again. We are not 100% able to prevent all the possible risk, but we must make all the 100% efforts to avoid it, and include even what we call prenatal counseling. We must counsel you. Unfortunately, most of us don't plan pregnancies in Nigeria and Africa, especially. We just got pregnant. We shouldn't be doing that. We should, especially in this kind of scenario, you have to plan that pregnancy. You need to know when you're going to get pregnant. People need to be sure it is okay. We need to make sure you're already on your folic acid. We need to make sure we're monitoring that pregnancy throughout. We need to make sure the pediatrician is aware. We need to be checking so many things. Sometimes we even test the baby in the womb for things as well. So it's a lot of work, which is why I say it has to be a teaching hospital. It has to be a place where people are ready to do everything. And there is nothing like, oh, there's no ambulance. Oh, there's no this. Everybody must be ready. We'll do our best, but it's not always 100%, but we try our best. If we try our best, most of the time, mothers who have a normal baby. I've seen also mothers who have had poor outcome and they have another baby and the babies are fine. So it's not always like that. But sometimes, especially in African setting, I've seen it happen again and it's always very painful to me. So let's make efforts to prevent it happening again. All right, let me just take this question from Instagram. Miss Sumi, my 10-month-old baby boy had a minor bruise on his penis, around the glands and foreskin, and I don't know how. You must know how. Why did it happen? There are some areas in children that should not be bruised. There are some areas in children that should not be bruised at all. The nappy areas, a child's, for the girls, their vulva, the boys, their penis or their scrotum, those areas are protected. Those areas are covered by nappies. Those are not the areas. If a child has a bruise on their legs, I'm not going to worry, especially if the child is crawling or walking, because they are going to have accident from falling and bruising. But they should not have bruises in what we call soft area of the body. They should not have bruises in the genital area. You must always know when they have bruises in that area, because it's always a red flag for us. And in countries like UK, for example, it's going to be a safeguarding issue, because we need to know, did anybody tamper with that child? Did anybody hurt that child? Did anybody abuse the child? Because there are areas of the body where children don't have bruises at all. If you use the word bruise, and I hope what you're referring to as a bruise is a bruise, because there's a difference between a bruise and an infection or a wound and all that. But when we talk about bruise, we're talking about bleeding in under the skin, and most of the time it is inflicted, so we really need to know. So unless you're not referring to the bruise, like maybe the child has a nappy rash or infection, that is a different thing. But if a child has a bruise, that's the word you're using, and that is where I'm answering your question. Is a flag. So I will first go and see a pediatrician, especially when you don't even know how it happened, because it's one thing to see something and say, okay, maybe because maybe I was changing the baby in my, and for those of I see mothers who has all these long nails, and I'm like, how do you take care of your babies? How do you change their nappies? Anyway, people say it doesn't matter, they can do everything, but really those kind of scenario I've seen it happen. The mothers accidentally bruise their children in the process of nappy changing with the long nails and stuff like that, or their rings. If you have all these rings that have all these stones that can catch the baby's skin, it can be accidental, but you will know how it happened. But when you don't know how it happened, then we are worried about it, because we need to make sure that it is not an injury. Please don't use penicillin. A lot of us do some things that just I know we're trying our best for the children, but there's something you should not use. Don't use penicillin without a doctor's prescription. Some children are allergic to penicillin. I've seen children collapse and die from those kind of allergic reaction. It can be fatal. So please don't use some drugs, especially antibiotics, when a doctor has not prescribed this. And usually most time when doctors even want to use it, they will ask you, has your child ever reacted to penicillin? So penicillin is not something anybody can just take and be rubbing or be giving. No, it's something that children can react to very seriously. So, and usually when we're giving it for the first time, then we are also checking and monitoring. We will ask you a lot of questions. So please don't use anything, antibiotics, that a doctor has not recommended because of allergic reaction. I'll recommend that you see a doctor first, because we need to know what caused that. So yeah, even if it's a cut is also not, because what is cutting the child? That's the question. Maybe you use the wrong word, I agree, but if you say a cut as well, it's still not sitting well with me. Whether a cut or a bruise, there are some places where children can have that and I will not worry, but a cut or bruise in the genital area is something that we're going to worry about. I think my phone is going to die. Okay, so I will just say see one of my colleagues first, and then we can take it up from there. Sorry, I just need to charge my phone a bit. All right, okay, I think I should just hold it. All right, okay, let's just move on. I'll come back to Facebook. Okay, Miss Fumi, please take him on and keep us updated. Monica, say good evening, Doc. My baby of 4 years and 4 months is still bedwetting. For a 4-year-old, we don't call it bedwetting. It's still within normal. We start using the word bedwetting from the age of 5. Okay, so 4 years old, just still do your potty training and complete it. That is what we call it. We don't call it bedwetting at 4 years. We call it it's still normal. But by the age of 5, that is when we expect them to stop bedwetting. So from the age of 5, that's when we will start saying the child is bedwetting if they are not dry at night. So if you don't wake her up twice before morning, it is so you there are many possible reasons. It could be does the child drink a lot of water? So there are things you can do. Number one, no more fluids after 7 p.m. The children should have their dinner by 6 to 7 max. No more liquid. Before they go to bed, make sure they pee, make sure the child is not constipated. One of the main reasons why children have bedwetting or when they pee on the body is because they are constipated. And I think I've explained that before, because the bladder and the rectum. The bladder is where the urine is. The rectum is where the poo is. They are in front of each other. If there's a lot of poo in the rectum, it will push against the bladder, so it will reduce the space inside the bladder. So even any little urine in the bladder, the child, the child will feel the pressure to pass urine. And when children are heavy sleepers and all that, they won't wake up and they'll just pee. So the first thing we always want to make sure when a child is, wet in the bed, is to make sure they are not constipated. You need to make sure they're eating lots of fruits and they're drinking a lot of water. It sounds contradictory because a lot of parents actually reduce water for children who are bedwetting. You actually should make sure they drink a lot of water so that they don't get constipated. But the caveat is that they should stop drinking by 7 p.m. So between when they wake up, 8 a.m., till 7 p.m. at night, they can drink up to 2 liters of water. They can drink, we say 6 to 8 cups of water. Each cup is about 250 mils. They can drink as much as possible. And sometimes children don't drink. You have to remind them to drink. And they should drink water, not all these juice, all these coffee and tea. Those ones actually irritate the bladder. And some of us, we give our children those things at night before they go to sleep. And then it's going to irritate the bladder. Then they're going to wet the bed, okay? So there are certain things you can do. So I always recommend Eric UK website. Eric is a charity that is devoted to supporting parents around bedwetting and stuff. So if you just Google ERC, let me see whether I can type it. ERC, that is the name. .org.uk, Eric UK. They have lots of resources for parents on bedwetting. Just go and read around it. You will understand the concept of the bladder, how it works and all that, and what you can do. So for your child, maybe the child is making a lot of urine, maybe the child is drinking a lot of water in the night and things like that. So you can make sure the child is also not constipated, drink a lot of water during the day. Also make sure some of the children, they actually feel the urge, but they won't go because they are busy with their devices. So you remind them to go to pee, once they feel the urge. So they get used to that. Also, some children are very heavy sleepers, so there's not too much you can do with those ones. So bedwetting alarms can help them. So there are alarms that you can put in and all that. But like I said, we will not start all these until the child is 5. We give them a little bit of time, but that doesn't stop you from starting to try some of these strategies before the age of 5 as well. But these are some things you may just want to look into and deal with it. All right. Olayinka, so what are the causes of urinary tract infection? It's bacteria, it's germs, So if a germ gets into the urinary tracts, the urinary tract is one of the you didn't tell us whether your child is a boy or a girl. It's very important. The urinary tract is one of the parts of the body that opens on the outside, okay? So where you pass urine, the same thing like your mouth open on the outside and your anus open on the outside, the urinary tract also open on the outside. And if you don't pay attention to hygiene, and especially for children, it's a 3-year-old, the commonest reason is when we don't wipe them properly. And most of us always assume that 3-year-old, they can wipe themselves. They can't do it properly. So you have to do it for them, because even though they will say they've done it, they've not done it properly. So when they wipe, they need to wipe from the front to the back. Even some adults don't know that when you're wiping after you pee or you poo, you must wipe from the front to the back, because the front is where the urine tract opens, and the back is where the poo opens. The poo side has a lot of germs, a lot of bacteria and stuff like that, whereas the bladder side is a sterile, it should be sterile. There should be no germ at all in it. But if you wipe from the back to the front, you are going to introduce all the germs at the back into the waterway in the front, and then that can cause the germs to enter into the urinary tract, and that is why the child have urinary tract infection. So it can enter from the outside. Also, if you're not paying attention to hygiene, making sure we change nappies frequently, making sure we change pants daily and things like that, germs can easily enter into the urinary tract from there. Also, if a child is very sick and there's germ, they have what we call sepsis, a lot of bacteria in the blood, it can also pass from the blood into the urinary tract. But that tends to occur with what we call the upper urinary tract infections around the kidney and the ureters. But most of the one you are referring to, the frequency and all that, we tend to have that with the bladder, and that tends to have a lower urinary tract infection, it usually is from germs being introduced into the urinary tract from the outside. That is for children. In adult women, for example, women, even having sexual intercourse and all that can introduce germs into your, which is why we say after sex you must always go and pee, so that if there's any germ, you quickly flush it out of your bladder. That is very important. And for women, especially girls, our urinary tract is shorter compared to the boys, so it's almost straight open to the outside, so it's very easy for germs to enter for the girls compared to the boys, because they have a longer urethra, whereas the girls, we have a very short one. So that is how infection like that happens. So I hope I've answered that questions correctly. Yeah. Okay. Onye said the mom is here. Okay. The birth rate is 3.5. So if the birth rate is 3.5 and the baby is 5 kilos at 6 months, that baby needs to be seeing a pediatrician right now. That baby is not thriving. Okay, baby should be doubling their birth weight around 6 months. So that baby should be weighing around 7 kilos now. So baby is weighing 5 kilos. I'm not happy with that. So you definitely need to take that baby to see a pediatrician, because that means baby is not thriving. All right. And the baby is not holding the head. That means baby development is also delayed. There are many things going on with this baby, which we need to sort out. The baby is just 6 months, so you just introduced the Cerelac, I hope. What were you feeding the baby before now? That is more important. Was your baby on exclusive breastfeeding? Was baby sucking well? Was there other problem the baby has at birth? What were the issues? And I'm really worried that, is this really not going for immunization? So because each time you go for immunization, we don't only just give the immunization, we also check for the weight of the baby. And so somebody is not doing their work, because if somebody has been weighing this baby, she must have been seen at 6 weeks, at 10 weeks, at 14 weeks, and they check the baby's weight and the baby is weighing 5 kilos. Somebody should have flagged that baby and referred to the pediatrician, or even just the doctor, to know why is this baby not gaining weight, because this baby has only gained 1.5 kilos in 6 months. Baby should be gaining almost 1 kilo every month. So if baby's only gained 1.5 for 6 months, I am very worried about it. So the baby is not thriving. And obviously that is also, it could also be why the child's development is slow, because the child doesn't even have the stamina to even maintain neck control and all that. So I really will recommend, and this is a very serious recommendation, that baby must see a pediatrician, if possible tonight, if possible the first thing tomorrow morning. It is very urgent. We really need to know what is going on. We need to work out. It could be some medical issue. I'm not sure whether it's the feeding. It could be feeding, but it could be other medical issue. But that baby needs to be in front of a pediatrician right now. So please, if the mom is there, I hope she's listening to me. That baby needs to see a pediatrician urgently. When babies are very underweight, or when they are failing to thrive, that is the 50% of all the underlying causes of death in children. So any child who is already underweight, who is not where their weight should be, we are over worried about that baby already, because any little infection, any little issue, that baby is already very vulnerable. So if a child has a normal weight, even if they are sick, we know that we can work hard with them. But a child who is already very vulnerable like that, failing to thrive on the weight, we pediatricians are so worried about them. So that is why I keep repeating, that baby should be in front of a pediatrician right now. We need to know what is going on. That should have happened before now. But I'm happy you asked the question, because that baby really needs to see one of my colleagues straight away. All right, Olayinka Femi Falola. I have good afternoon. I have a 2-year-old who has serious dried rashes only on his tummy. Serious dried, okay. Anyway, on his tummy area, back portion of his hand that are so itchy. Dry rash, itchy rash, that is beginning to sound more like what we call atopic dermatitis or atopic eczema, especially on the areas you're also mentioning. You shouldn't be using Skenil. No. You shouldn't be using Skenil. Skenil is a steroid, and they call it like a triple action drugs. It has a steroid, it has an antibacterial, it has antifungal, we pediatricians don't usually recommend that. We need to know what exactly we're dealing with, okay? So most of the time, children don't have a mix of other. It's either they have a skin infection or they have an allergic skin condition, and they're all different things. For children with allergic conditions like atopic dermatitis, the most important thing is to avoid the triggers, avoid what is irritating that child's skin, starting from making sure you are using what we call natural hypoallergenic products on the child's skin. So you are going to be using product that doesn't have a lot of acid and all those kind of stuff. So you're going to be using things that doesn't have all this perfume. Vaseline Blue Seal is good for people with atopic dermatitis without the perfume. That's Vaseline Blue Seal that doesn't have any perfume. Even the soap, you need to watch out. Even down to the soap you are using to wash the child's clothes. All these detergents, you need to make sure you are rinsing them off thoroughly, even to the surfaces the baby lie on. So before you put the baby on any surface, you first put the baby's own blanket or something, so that you are sure that there's nothing that will irritate the child's skin, okay? And you have to keep the skin moisturized, no powder. A lot of us use powder on baby skin. It's not really recommended. You're only drying up the skin. This baby skin is dry. We want it to be moisturized. We want it to retain water. So using something like Vaseline, something like there are products that have hypoallergenic product, things like your Sebamed and all that, and you use the whole range, not that you use the Kuson soap and use the Pierre's oil and use only Sebamed lotion. No, when you're using it, you are using everything like that. Or even the normal black soap that doesn't have perfume, not the one that has perfume. Let me not mention any names. You have to use things that are natural, keep the skin moisturized. You may need to apply it often, and that is it. And if there are things you're giving the child, like drugs or like even some food, some children are allergic to maybe the milk. There's so many things that can cause those reactions. You may need to avoid them. If you are not sure which one is causing it in your child, you have to see a dermatologist so they can work it out. Sometimes we don't know what is causing it, so we just we manage it. So it's a condition that it's a kind of a genetic condition. That's how the child is born. The child has that sensitive skin nature, so they are prone to very any little reaction, they come up with the rashes and the itchy. We also keep the nails short. We also give them something to reduce the itching and all that. So those are the way we manage it. So if it's really bad, then your pediatrician can prescribe steroids. So they can prescribe hydrocortisone and other things, but the most important thing is to do the general care, which is what I've told you right now, avoiding things that the child can react to, avoiding all those stuff. Then when you see your pediatrician, if he's still having a lot of flares, then they can prescribe things like steroids for a short while, because there are side effects, terrible side effects of steroids, which is why you should not be using Skenil. I've written an article on that already. Don't use medicated cream in children. A mother was asking that question on last week, not last week, Friday or Saturday, about a baby, like, should I be toning my baby's skin? I really was very upset with that question, because I really felt we shouldn't even be asking certain things. These are very dangerous chemicals that can damage the internal organs of babies. Steroids have a lot of terrible side effects. You just go and Google the side effect of steroids. Even with pediatrician, when we give baby steroids for health reasons, we have to monitor them for the side effect. We have to give them the lowest dose possible. We have to tail it off. Sometimes we give them what we call period of break, and they'll come back. Because of those side effects, the child can become very short. The kidneys, the child can become very obese, and that they can have ulcer. There are several things that come with steroids. And the fact that you're applying it on the skin, baby skins are so porous, they absorb everything. So that steroid is going straight into the blood. So do not use any medicated cream in children unless the pediatrician has prescribed it. And whoever is prescribing it will be monitoring and will be taking responsibility for it. And they usually use it for a short while. Whereas I see mothers who use the Skinil and Fombate, whatever, they use it like ABF, whatever. They use it like regular cream for their babies. These are very dangerous practices. We've written about it. Please, that should never happen. It's very, very important. Okay, I know I've gone overboard on that, but it's something that I always try to make sure that mothers understand the implications, and especially those mothers that want to tone their baby's skin, that are getting complex, giving little children complex about black skin at 6, 7 years old. Please, mothers, we need to really stop. Your baby's skin is genetic. If your baby is going to be black, your baby will be black. If your baby is going to be fair, your baby will be fair. It has nothing to do with any cream you put on that baby's skin. Okay? Even if it's just Vaseline, a fair baby will be fair, even with the Vaseline. And a black baby will be black, even with the Vaseline. Please, let's not use dangerous products on our children's skin, and let's not give them complex like the sisters are fair and the child is only one black. And so what? There's nothing wrong with that. There's somebody in your family that is black, that's why your baby is black, and there's nothing wrong with that. Okay, because it's genetic. The baby has that gene inside them. So, and black is better. You protect your child against all the skin cancers. Anyway, that is just by the way. All right, let's move on. Williams, Victoria, my baby is 6 months old, cannot see without asking me, without me sitting at the back. That is still normal for a 6-month-old. Sorry, I'm trying to change my. Let me see which one is low. Okay. So your question is, there's nothing wrong with your baby. Baby's sitting with support is 5 to 6 months old. Sitting without support is 7 to 8 months old. So there's nothing wrong with it, child. What kind of food can she eat to gain weight? What is wrong with her head? She's unable to hold her head. Okay, if she's unable to hold her head at how old? At 6 months, then that one is delayed. Holding the head is a 3 to 4 month old skill. Sorry, my phone is almost dying. That's why I'm trying to charge it. Okay, so holding the head is a 3 to 4 month old skill. So if your baby is not holding the neck, you shouldn't be talking about sitting. That's why I was confused, because you started with sitting. So sitting is not what we should be talking about in a child who doesn't even have neck control. The neck control is number one. If you don't have neck control, you can't sit. They follow each other. So this baby needs to be in front of a pediatrician as well. A baby who doesn't have neck control at 6 months has what we call developmental delay. There are many possible. It could just be developmental delay only with the sitting and walking and crawling, which is gross motor, or it could be general developmental delay. So you definitely need to be in front of a pediatrician. And you didn't tell us the current weight of your baby, so we can't talk about baby gaining weight. We need to know what is the current weight, then we can talk about what the child needs to do to gain weight. So what is the current weight of the baby? But I think my main worry is the fact that your baby doesn't have neck control at 6 months. That is delayed, because even though I say, okay, we give baby time, but 3 months is normal neck control. By 4 months, if that doesn't have neck control, that is delayed. When a child, if you listen to my webinar on normal development, if a child, at the time maybe should have another milestone, the child does not have the one before that milestone, that is how to know that child is delayed. In other words, as at the time we expect your baby to be sitting with support, your baby does not even yet have neck control. That neck control is delayed, okay? Because at 5 to 6 months, I say you'll be to sit with support, but the child doesn't have neck control. That is very significant delay. So you have to see one of our pediatrician, and we can take it up from there. But the baby born preterm, this one is non-preterm. You're supposed to deliver on the 16th and you deliver on the 9th. That is still normal. There's a range of delivery. So your date is 40 weeks. So if you deliver a week before, that is still 39 weeks, and that is still normal. So if you deliver like a month before, that is when it is preterm. It's a must. Are you asking if it's a must, or you are telling us? Okay, I guess you are asking, is it a must for a mother birthing a new baby to be throwing baby up and down? Is it a must, or is it something that the mother should not do, that we should be flogging the mother for? Please don't ever throw any baby up and down. I've said about that before. I've written about that before. I've seen babies die from that. I've seen baby have head injury from this unnecessary and very dangerous thing. It's not even something a must, that is it a must you must do. It's something you must not do. What are you throwing the baby up and down for? And I've seen a very terrible video of all these Nigerian mothers, when they are, all these our grandmothers, they are bathing baby, they are twisting their leg, twisting their hand. Please, nobody should do that to any baby. All those are very dangerous child health practices. There's an article, there's a podcast we have done in the past about them. Maybe you need to visit our website and read about them. So there are dangerous practices in Africa, especially. One of them is this throwing baby up and down. Please, it should never be done. It must never be done. It doesn't have any advantage whatsoever, and it is dangerous. That baby can slip from your hand. And it has happened, because sometimes when we say these things, people think, oh, maybe we're trying to frighten you. I saw somebody put a write-up that doctors sometimes say things and to frighten their patients. Doctors have we hold duty of confidentiality, so I cannot be telling you go and meet so and so, the name of this person, but I can tell you for free that these things happen. I've seen mothers that force feed their baby and the baby died. We've seen it. I've seen babies thrown up and baby fall down and had head injury. We've seen it. These are not, if you only come to children emergency, you will see all these things. These things happen. We see, when we say don't be doing steaming, I've seen babies go to hot water burns. Even some of these bathing babies, all these mothers, these professional babies, bather, whatever they call them, some of them have burned baby with hot water before because they don't even check. And they'll just put hot water, and then they just pour it on the baby. So please, and they should not throw the baby up and down, because a baby is even very slippery, and they can sleep. Not to even talk of the one you are throwing up. What if you don't catch the baby? And what are you throwing the baby up for? And the baby's head, their brain, all the blood vessels, they are still very fragile. All this throwing babies up and down, and all this shaking of babies, you are causing bleeding in the brain of the baby. And some babies are going to end up what we call abusive head trauma from that. So please, and mothers, I've told you, you can bath your baby by yourself. There's no special bathing skill. It's something you can learn. Just take it segments. If you go on our side, I'll say just segment. Just wipe the face first, wash the hair like you wash in salon, dry it, then wash the rest of the body gently. You don't need to scrub them. You just need to small face towel, small foam with a little bit of soap. You just wash them and then use water, and then you dry them. It's not rocket science, and you don't need to twist their body. You don't need to massage. You don't need to throw any baby up and down. Just wash them, dry them, put Vaseline or oil, olive oil, whatever on their body. No powder, nothing, and just breastfeed. Baby's life are so easy. God has made everything they need for them. You don't even need to stress yourself, and you can do it. So please don't do that. Throwing baby up and down does not make any baby strong. It doesn't make them to avoid fear. You can damage the brain of the baby. I'm a neurodevelopmental pediatrician. I see children who live with long-lasting disability from all these issues. That's why sometimes I talk so passionate about them, because I see these children all the time. And these are preventable things should never have happened in the first place. I've seen, when we say don't give baby water, I've seen people give a baby kerosene and the baby died because they're mistaking the kerosene for water, because some of you will put kerosene inside your evaporator or whatever for water. These things happen. People think, oh, it can never happen to me. It happens to people. And they didn't also think it will ever happen to them. So please, let's not throw any baby up and down. My time is up. I need to go. If the mother is not feeding well, will it affect the baby? If the mother is not lactating, definitely it will affect the baby. Please. Okay, final set of questions. Is it preterm if the scan gave you the blah blah and baby was born on 17? The scan is not what tells us the dates of the delivery. It is not scan. The good old-fashioned your last menstrual period is the most accurate. And you've been going for antenatal. The doctors are checking your womb. They will know how far you are along, and they will compare it to your EDD calculated on your dates of last menstrual period. Unless for those of you who don't have last menstrual period, it is those people who don't have regular periods, so they don't know the last time they saw the period. Those are the people that we have to now rely on scan, and it has to be the scan we did in that first few weeks of pregnancy, with the first trimester scan, not the one you are doing at second, third trimester. That one is going to be inaccurate. We don't use the scan EDD in the last second trimester to determine the date of the pregnancy. We use it to check for whether the baby has any abnormalities, whether there's enough water, where is the placenta. Those are the things we use that one for. For the dates of the pregnancy, it has to be something you've done in the first 6 to 8 weeks, not the one you are doing after first trimester. So, and what is important to you is your last menstrual period, and that is what is used to calculate your baby. And if your baby was born and your baby is preterm baby, your doctor will tell you. They don't just tell you have a baby, a preterm baby, and you are. We will know from the weight of the baby. We will know from the look of the baby. We will know, and we will tell you. We will tell you everything. So there's no reason you can't be confused about whether your baby is preterm or not. So because the way baby look and everything, your doctors will always tell you, and there's a way they behave as well. All right. Okay. Thank you so much, everyone. It's been a wonderful time today. If you have any question, if you know your last menstrual period, go online and calculate your EDD by yourself. There are apps. These days, you don't need to be stressing doctors calculating things for you. There are apps that will calculate your EDD for you. Just put in, my last menstrual period is 7th of Kineko. When it's my EDD? How many weeks am I now? It will calculate everything for you, and you will have it. So download it on your phone. That's why all of us have smartphones now. Even for the weight of your baby, all those people that always ask me about the weight of babies, you have apps that will tell you all those things. There are people that, and they are free. They are not. You don't have to pay a dime for them. So use them. All right. So doctors too will relax. Okay. So thank you so much for joining me today. If you still have any question, you can post your question on our Facebook group. Birth weight of 2.5 is a normal birth weight. So preterm baby usually will weigh lower than that. So unless baby is big, maybe mother has diabetes and things like that. Average 2.5 kg is normal birth weight. All right. Okay. So if you have any question, feel free to go to Ask Paediatrician Facebook group, and we will answer your questions Mondays to Saturdays. This is just 1 hour, but we are there online. Just drop your question. Please be patient with us. There are questions that people will answer you within 1 hour. There are questions that if I'm going to come and answer it, as I'm here now, I won't be able to answer that one until I'm done. So that may take a little bit of time. And remember that all our people are volunteers. We all have our full-time day job as well, so we can pay our bills. So please be patient. When you drop a question, be patient for us to answer. If it's something urgent, a child is sick, a child is having convulsion, child is please go to the hospital. We always say that. So thank you so much. Have a wonderful evening. I'll see you again next week, Monday, God's willing. Remember, our anniversary is coming on this in July, so watch out for that. Have a wonderful evening, and I'll try and sort out our Instagram and StreamYard before next week by God's grace. Take care. Bye.